So I applied for the Health Profession Scholarship Program. So I had actually gotten into optometry school first, did my first year before I even looked into the military.
Welcome to Experience Armymedicine Interviews. Our mission is to interview local medical professionals within the Army so they could detail their impact in medicine today. Today's interview is with Major Jennifer Frazier, 73 Alpha, social worker. She hails from Weed Army Community Hospital, Fort Irwin, California.
Name is TJ Peper. So I'm a major in the Army, and I am an optometrist, a 67 Foxtrot. Growing up, I always wanted to be a musician, a percussionist. I actually got my bachelor's degree in music, and I thought I'd do that. But then I started looking into other careers. I have a brother-in-law who did medicine through the Air Force, and he got me looking into it and all the wonderful possibilities. Growing up, I always thought military was just going overseas, knocking down doors. Didn't realize there's so many opportunities to serve in this way. So I started looking into it, talked with a recruiter, and found out there were a lot of opportunities to serve and do what I wanted to do while serving my country. And I looked into it and met with a recruiter, and we made it happen. Growing up, I always had glasses, contact lenses, so I appreciated sight and being able to see clearly. But it was really so my mom actually was diagnosed with multiple sclerosis, and she was first diagnosed by her optometrist. And it was weird because, he was looking in her eye and looking all the way back to the optic nerve that connects the eye to the brain, and he was seeing some swelling and some issues there, and he was able to make that diagnosis and appropriate referral. And so that was the first time I really was opened up to the idea that optometry is a lot more than vision and glasses. It has to do with, your whole health, the systemic health. And so looking into the whole medical side of optometry got me really excited about it. And so looking into that, I saw, it was so much more than just vision. It was health of the eyes, health of the whole body, and that really got me excited. So I shadowed some optometrists and saw what they got to do, and it sounded amazing to me. So I applied for the Health Profession Scholarship Program. So I had actually gotten into optometry school first, did my first year before I even looked into the military. And talking to a recruiter, I found out there was this way that the military would help pay for some of my schooling. And there were different options out there. There was like a 4-year, because it's a 4-year degree. There were some options to pay for 4 years, 3 years, or 2 years. By the time I applied, I had about 2 years left, so I got a 2-year scholarship paid for. And so my obligation then was to serve for 3 years afterwards. So I met with the recruiter, did all the paperwork, all the legwork necessary to be able to commission in the military. I paid back my additional 3-year ADSO, and I loved it so much. We stayed in. We're still going. A lot of it's just like a normal private practice doc. We see. I probably see about 12 to 14 patients a day, mostly routine cases. We see obviously a lot of soldiers, but we also get to support their families as well. So we see kiddos, we see adults, we see retirees as well. So we really get to see the full spectrum of patient care. Most of it's routine exams, but we also I consult with a lot of the other doctors here as well, especially with the emergency department. So a lot of the acute emergency eye conditions, we see those as well. So each day I'll see a few walk-ins, a few acute injuries, things like that, especially with soldiers out in the field, get poked in the eye, get stuff in their eyes, so we get to help out with that. So the majority of it is patient care. Being active duty as well, we're known as being a dual profession. So I'm a soldier first, and so I also have a lot of administrative responsibilities also that I get to do kind of in between to basically run the clinic, make sure everything's running smoothly. We're up to date on all of our training, safety codes, all that good stuff as well. Yeah, actually, even tomorrow I'm going to, I get a day out of the clinic to go to the range to renew my qualification for pistol, right? So we have to stay up to date on all of our warrior tasks, all of our training. So, we get a lot of training as far as, shooting guns, our land navigation skills, all the fun, just basic Army skills that way. So we do that every year, make sure we keep up to date on that, it was always fun. The military there, it's a little, we do get a little bit more exposure to things like TBI or concussions. Especially with optometry, we deal with that a lot. And so we get some specialized training in how to deal with what we call neuro-optometric rehabilitation, where we can help people with brain injuries kind of recover from that. The military also helps specifically for optometry with some other training, like specialty contact lenses, prosthetic lenses that some soldiers could need, even some vision therapy, things like that. So the full spectrum of optometry care that we do in the civilian world, we get that as well. But then on top of that, we have all of the other, like I was saying, the training of how to be a good soldier, right? And then there are always opportunities to get extra training as far as administrative work, how to run the financial side of the clinic, and things like that. And it's really where you want to take it. The military gives you a lot of possibilities of how to run your career. If you want, you could stay mostly clinical for the whole time you're in the military. But it's also very possible to go more of a clinical route, more of an administrative route, where you can be a commander of different units. You can even run a hospital, right, if that's the direction you want to go. And if that's the direction you want to go, the military will absolutely help you get there. They'll give you the necessary trainings. And so they can customize it to what you're wanting to get out of it, and they'll give you the training necessary to do it. So I'm a big Denver Broncos fan. I love me some football. So I definitely watched some football. This season wasn't great, but I do a lot of volunteer work. I'm a Christian. I spend a lot of time volunteering at my church. I teach the youth Sunday school every week, and coach a lot of youth sports. The Army always does a good job with the youth sports in the community. So I get to soccer, flag football, basketball. Even get to teach those, coach those a lot. I like spending time going out. There's a lot of wilderness out here to explore, so we like to go outside a lot. Which luckily, the military gives us a lot of time to do that as well. A lot of weekends, we're good to go. I'm a big music fan. I like playing the drums. So if I can get a group together, play some music. And then, a lot of family time. We do family pizza movie night every Friday, and we like going on vacation. One of my favorite, well, I'm not getting ahead of myself, but one of my favorite duty locations, besides Fort Irwin, of course, was I just came from Germany. And so we were stationed there for a few years, and it was amazing, all the traveling we were able to do. As a family, we were able to go all over the country, all over the continents, and visit so many places. And so the military allowed us to do that, have those experiences, travel with the family, make some fun memories. I would say the huge one is stability and security, I should say. Especially with COVID happening, that pandemic, I had some classmates who lost their jobs, working in a private practice because they were the younger ones, they lost their jobs. I never once for a second worried about a paycheck, about losing, access to healthcare or anything like that. So the healthcare that's there, you get what you need. I never have to worry about housing. They always give me somewhere to live. I don't have to worry about paying my, cable bill or my, I should say electricity or water bill. That's always covered, right? So having that financial security is huge. Whether I see one patient or 20 patients a day, I know I'm getting that same paycheck, and I'll be safe. The opportunities to travel the world and see new experiences is huge in the military, and so you'd be giving that up. It's really hard if you have to pay to move yourself from, every once in a while, you can't keep that up, right? But the military pays for you to move all these places, and so it's really easy to do that, which would be a huge sacrifice in my situation. And again, just knowing majority of the time I'm working 7:30 to 4:30, and I'm going home the majority of the time, right? We're in the civilian side in order to make enough money, you got to work nights, you got to work weekends, you got to work longer hours, right, to keep that up. And for me, I'll take a little bit of a pay cut to spend more time with my family and have that job security as well. And that's been perfect for myself. But then also just losing out on the training opportunities that the military will give us, that's completely covered, right? I don't have to pay extra to go to these trainings. It's all offered, right? And so that's a huge benefit that it'd be difficult to not have those opportunities in the civilian side. One of the things I love about Army medicine, it's a very clean way of practicing medicine. What I mean by that is because of the TRICARE, the health support here, a lot of times if my patient needs a medication or needs some imaging, I don't have to fight with insurance. What I need, they get, right? If I say you need this medication, they go to the pharmacy and they get it. Where in the civilian side, you spend a lot of time fighting with insurance companies to try to get the best product for the best price and things like that. But here it's great. If I need an MRI ordered, I just put it in and they go get it, right? There's no fighting. It's really easy that way. And so it's great to be able to practice without those stumbling blocks in the way of you get the patient what they need. And again, what's great about military medicine is they can tailor it to what you want to do. If you want to specialize in specifically, traumatic brain injury, especially contact lenses, or just primary care, you have those options. If you want to, again, go a little bit more of the clinical route, they can absolutely tailor that to you. And so if you get in, you'll see all the possibilities. The military is huge in education. If you're considering doing a residency, they can do that as well. And normally in the civilian side, you take a huge pay cut to do a residency. Or in the military, you get your normal salary. You get paid like you would anyways. And so a lot of great opportunities there. And the other thing is, you try it out. If your initial obligation is for 3 years, try it out for 3 years. And if you find that that's all you needed, you can easily get out, and it's an easy transition, right? Everything you learn here can easily transition to the civilian side. But if you find out you love it, there's so many opportunities for you to stay in as well.
Thank you for listening in on our Experience Army Medicine interviews. We hope that these interviews help encourage your own path into a healthcare career. If you enjoyed the interview, please don't forget to like, follow, and share our content as we continue to dive deeper into Army Medicine. Be all you can be Army Medicine.